Hello, audience. I, Dr. Prajakta Sahasrabudhe, would like to welcome all of you to today's Physio TV session, Tele Rehabilitation, a paradigm shift in pulmonary rehabilitation. Pulmonary rehabilitation has become a household name as a consequence to COVID-19 pandemic. 13th to 19th March is celebrated as a Pulmonary Rehabilitation Week. On this occasion, today's topic is dedicated for pulmonary rehabilitation. Today's topic, that is Telerehabilitation, a paradigm shift in pulmonary rehabilitation, would be taken by Dr. Rashida Bookwala. She has a clinical experience in the field of pulmonary rehabilitation for more than 5 years in multiple reputed hospitals, multi-speciality hospitals in Mumbai. And now recently she has become her freelancing consultancy in the field of tele-pulmonary rehabilitation. Welcome, Dr. Rashida, and over to you.
Hello, everyone. Today we'll be talking about telerehabilitation, a paradigm shift in pulmonary rehabilitation. I'm sorry, but this is not sharing right now. Hello. Hello.
Can you try sharing it again? You already are a co-host.
Sorry?
You are co-host.
Okay. One second, I'm just doing it. Yeah, can we start now?
Yes, we can.
Yeah. So hello everyone. This is Rashida Bookwala. Today my topic, what we'll be talking about is telerehabilitation, a paradigm shift in pulmonary rehabilitation. So what are we going to cover? First, before talking about telerehab, we will focus what is telehealth, what is the history, how did telerehabilitation come into the scene, what are the need, barriers and facilitators for it, the components. The main focus is going to be on the crucial element for telerehabilitation, that is assessment. Yeah, so we talk about telehealth. Now, telehealth technology allows for distribution of healthcare services, that is information between a healthcare provider and a patient in different geographical locations. Initially, this was normally from the urban areas. It was an avenue to reach people who lived in the rural communities. There has been a change since the pandemic, the 2019 COVID pandemic, where in 2020, we have seen a sudden rise in telehealth, telemedicine, where there is delivery of healthcare and the exchange of healthcare information across distances. So when we are going to the history, when you're talking about the term telehealth, telemedicine, it's nothing new. It has been there since 1924. Our magazine had first used this. There was a cartoon depicted about teleradio consult, which was first in 1924. Then you had the first published study, which was on teleradiology in 1950. When you had seen initially in this era, there was a lot of this telehealth taking place or telemedicine taking place, which was for people who were living in the rural areas who didn't have access to healthcare. It was for the prisoners. And the focus was mainly in sharing of data, especially in teleradiology. Then in 1998, we have the first study which is done for telerehabilitation, which was done by R.B. Burns, which was about disability and physiotherapy management of it. Now, when you will see in this era from 2000 to 2004, there was a rise in literature as well as people doing telerehabilitation. Then you will see there was a sudden dip, which was attributed mainly because of the changes in the setting of using the devices which we were using for telerehabilitation, the internet connectivity and all. And then later on, if you will see again from 2007 onwards, there was a rise which was seen. if you will see, there was a study. Our focus is going to be mainly on pulmonary rehabilitation. So when you will see, there was a systematic review done in 2010, which talks on COPD patients doing telerehabilitation. It gave, when you will see the results of the study, there was a comparison that is between normal hospital care, that is a standard pulmonary rehabilitation program, versus telemonitoring, and few studies which were considered were usual care versus telephonic consultation. When you see, there was quite a decrease in the hospital readmission rates and exacerbation seen in patients with COPD. Then we had a full resurgence where we had started, where you will see a lot of people practicing telerehabilitation was after the COVID-19 pandemic in 2020. Now we'll focus what is telerehabilitation. When we're saying telerehabilitation, it is describe the delivery of rehabilitation services. Here our topic is focusing on pulmonary rehabilitation, or it could be any other exercise training using a telecommunication technology. Now when we are talking about telerehabilitation, what all we need to consider? See, a telerehabilitation can occur in two ways. That is the location. Either the person who is conducting the telerehabilitation. In this example, I'm talking about a physiotherapist who would be sitting at a center and would be monitoring and assessing and rehabilitating patients at a community center, or rehabilitating patients directly. There is a connectivity to the patient's home. So either it could be to a community center or to the patient's home. Then the method. Now there are different ways in which telerehabilitation can occur. Either there is a real-time visit with an audio, video, or both. That is via a WhatsApp conversation or on a Zoom link. And this is via your smartphone or a laptop, which has a webcam installed. Or you have a internet, which is used to transfer recorded videos, images of exercises. The patient performs it. He records the videos and is sent back to you for correction or to know if there are any changes required. Or there is just a telephone assessment which is done and a guidance is given to the patient on the management of his condition. So these are the methods of telerehabilitation. Right now, since the COVID-19 pandemic, our focus, which we have been doing, is a real-time visit audio or video in telerehabilitation. Now, what is an ideal telerehabilitation setup? An ideal telerehabilitation setup should have a smartphone or a laptop which has a webcam installed, so that there is going to be, you can text also, there is video conferencing also. You need a good Wi-Fi setup which is there, and a secured one. And the other thing is that you need to be having a cloud server where your data, whatever monitoring you're doing, is recorded. Now we'll focus, why did telerehabilitation come so much in the limelight? What was the need for it to come? So when we will talk about this, we know pulmonary rehabilitation is a very critical component in your chronic respiratory diseases. And it is a level A recommendation for every person suffering from COPD or any chronic respiratory diseases. Despite its benefits, we know that the patient's attendance, adherence to the program of pulmonary rehabilitation is very low. A recent study says that people suffering from COPD who are referred for pulmonary rehabilitation, their attendance to a pulmonary rehabilitation program is less than 2%. This is a recent study done in 2020. If you will see like a systematic review which is done in 2018, it tells that people who were referred for PR who did not attend ranged from 8.3 to 49.6%. And the people who did not complete was from 9.7 to 31.8%. So this is a huge number where people who are not getting access to pulmonary rehabilitation. The main reason where they have an issue is travel. That is, travel to a center to undergo a rehabilitation process. The other common barriers which were pointed out by the ATS ERS paper of 2015, where they were focusing on enhancing pulmonary rehabilitation, was insufficient funding, limited resources, lack of awareness, and limited training opportunities for physiotherapists also. Then when in the paper, one of the limelight was either you do a house, that is a home-based pulmonary rehabilitation, and the other important thing which was addressed was telerehabilitation, which again came into focus again in the pandemic, that is in 2020. So we will be Now talking, what are the facilitators for telerehabilitation? Why do people like more patients population? How it helps more than a center-based rehabilitation? That is going to be because it's time saving. There are face-to-face consults, that is on if you're doing a real-time video audio consultation. There is less commute involved. Engagement and motivation is there, and they don't need to depend on anyone to come to the center. They can manage it by themselves, or if they need help, the help is for a shorter duration from the caregiver. There are barriers also. That is, the common barriers which people face is limited resources and lack of healthcare professions which are doing telerehabilitation, which there is a change in scene since 2020. Initially, there was lack of healthcare professions who were doing telerehab, but now there is a complete shift which we are seeing. The next is the specific, that is, some people have internet issues, difficulty in assessment because people who have neurological conditions or maybe some musculoskeletal conditions, assessment becomes difficult by the physiotherapist. Until now, there is no evidence-based guidelines on how a telerehabilitation session has to be conducted. What do you need to consider as a physiotherapist? And that there is no guideline till now which is produced. So now we'll be talking about telehealth. Now, when I'm talking about telehealth, telemedicine today, its only focus is pulmonary. So when we're talking about this, we need to focus on a lot of other points. First is going to be teleconsultation. There is going to be telemonitoring. There is teleeducation, which all along together we have teleassessment and we have telerehabilitation. When we are talking today, our main focus is going to be on teleassessment because that's a crucial element for your rehabilitation to take place well. If you are not going to be able to assess completely in a detailed manner, you won't be able to conduct your telerehabilitation, not be able to justify and satisfy your the entire when you are doing your rehabilitation process for a patient on tele. So teleassessment is going to be a crucial element for your telerehabilitation. Yeah. Next, now when you focus the first on the definition of pulmonary rehab by the official statement of ATS ERS in 2013, if you will read that, the first statement says it's a comprehensive intervention based on thorough patient assessment. So at pulmonary rehabilitation without patient assessment, we will not be able to carry out in the desired way. So the focus is what? That is a comprehensive intervention based on a thorough patient assessment, which is followed by patient-tailored therapies, which include exercise training, education, behavior change, and this will improve the physical as well as the emotional condition, and it will promote long-term adherence. So the focus is on patient assessment. So what does our assessment include? So we have a detailed medical history. We have environment and house history, which is a very important thing, which we'll discuss in detail in telerehabilitation. Then you have physical activity history. Then you have subjective measures and objective measures. So we'll take each and every one. So first, when you talk about medical history, how when a patient walks into your clinic and you're doing, or into the hospital setup, you're doing a one-on-one assessment. The same thing needs to be done when you're doing a telerehabilitation program when a patient is enrolling into. So you need details on the medical history. You can give them a form, or you can have a layout which is given to them before, email to them, so that they know what all they need to keep ready, or they can email it to you back with all the history and all. And then you can go through it and then ask questions. So it works both ways. So your focus will be on the medical history. Then you have the respiratory history. In the respiratory history, what is the diagnosis? What are the PFTs? Comparison of PFTs, if there has been any prior PFTs which have taken place. Then you have the smoking history. When has the patient stopped smoking, or is he continued smoking? How many cigarettes or whatever he was taking, tobacco use, how many were in a day? Then you are going to talk about the medications, what delivery devices, and vaccinations. Vaccination schedule, if you're talking about, pulmonary patient, whether they have taken the pneumococcal, the flu vaccine. If you're seeing a patient who has taken, now you will be talking also about whether they have taken the COVID vaccine. Then you're going to talk in detail about the dyspnea. So you're going to ask them to describe what is the timing of the day, how you have a patient come to you and they tell you the same questions you need to be asking. That is, dyspnea is after which activity, what timing of the day, when do they get dyspnea. You're going to talk in detail about cough. That is it productive? Is it non-productive? Is there, if it's productive, what is the color of the sputum? What is the quantity? The timing of the day? When do they get this sputum? If there is wheeze which is present, fatigue, you're going to ask them to describe the timing when they have fatigue, after which activity they have fatigue, have they been exercising, if they have any limitations to their activities of daily living, when they are doing any activity, or is there any timing of the day where they complain of chest pain, and if they are having any current set of exercise routine. So these are going to be your questions. You can just send them a questionnaire sort of, which you have your points and you ask them to tick, and then when you meet them, you ask them more in detail when you meet them on your internet connection, or you ask them when you meet them first time. Now you have is objective measures. Normally, whenever you're doing a tele rehabilitation or a plan for a tele rehabilitation session, you should also always have a prerequisite mail which is sent to them, which tells about the medical history, what they need to be prepared, so they keep their documents ready, what devices which they will need, if you think they will be able to procure or they won't be able to. You will be sending them a copy of the modified Borg scale, so they know they can keep it on their computer screen, so they understand when they are doing exercises, when they have to say what level they are at, and if they are using, if they have a BP apparatus, a pulse oximeter, or a height and a weight machine at home. Then you have is your physical measures. Now, when you're talking about the physical measures, we have for assessing lower limb strength, we have the 5 repetition sit to stand test. The 5 repetition sit to stand test is a very simple test. It is used in COPD patients. I'm not talking about in tele, but it has been shown an MCID, a minimal clinical significant difference in COPD patients of 1.7 seconds. What are you supposed to do? You're sitting comfortably on a chair. The chair height from the floor is going to be around 46 centimeters. The patient is asked to stand up and sit down. Repeat this 5 times. And they're going to commence the test on the word go. And they're going to do it as fast as possible for 5 times. And you're going to record the time. And it has to be without arm support. And they should not be using any assistive devices when they are doing this. So that can be used. And then you can, after your rehabilitation program, when you have done, you can reassess it. So you will come to know the difference, what has been the change in your lower limb strength. The other which you can use is your lower limb endurance. That is your 1 minute sit to stand test. That is in 1 minute, how many repetitions they can do of sit to stand, which also gives you about the functional capacity of patients with chronic respiratory diseases. Next, you have is your subjective measures. That is going to be breathlessness, which we know we do on the MMRC scale, the quality of life, which is on your St. George Respiratory Questionnaire or your chronic respiratory questionnaire. And then you have your psychological status with your hospital anxiety depression scale. So these are measures which you can send it to them, keep them ready so that they can answer. Or if they have any doubt, you can help them out to fill this. Then the important thing, that is the environment or the home history. Now you have to also remember that when you're doing a tele rehab session, you are not present with the patient. So there are certain things which you need to be aware of. So before you start the session, you need to see the area in which they are going to do the exercise. If you need certain equipment, you should ask them to keep that in the vicinity. Is there an option where they can walk? Are there chairs, and is the chair suitable for you, or is it a chair which is a little wobbly? If there are steps in the surrounding, and you need to know about the lighting of the area, if there is anything which can cause a hazard like a fall with any rugs, clutter, how is the furniture placed over there in the view of where your camera is or wherever they are going to exercise, and if they have any pets. So that's a very important thing in tele assessment which you need to do prior to conducting your tele rehabilitation. Then before you start that, you need to be very clear with which patients who can be included in your program and who has to be excluded from the program. Now your inclusion criteria, most important is that they need to have access to a phone or a video conference platform. They need to have a device which has real-time video camera function. They should be having either a caregiver who can help them to operate this, or they themselves should be confident to take care of this technology. They are willing to participate in this program on a real-time audio video. They know that they will have a designated area where they will be doing the exercise, and that's going to be live when they are going to be doing the exercise. And in case of any emergency, there is a telephone contact number which is given. If by chance the video stops or there is some other emergency in which they have to discontinue the session, at least there is a telephone. Then if the patient can mobilize himself independently and safely without a walking aid, with or without, and how comfortable they are, they can get, if they have any home exercise equipment, maybe they have a cycle, home cycle is there, or maybe they have a treadmill, are they comfortable to get on and get off it without any assistant? How willing they are to participate in the program, and they can give you a informed consent, either a verbal one recorded, or they have a written which is mailed and given to you. Then you have an exclusion criteria. Now the exclusion criteria is going to be like a cognitive impairment. Those people cannot be on a tele program, any unstable cardiac or neurological disease, unable to participate due to any musculoskeletal issues. There is poor balance where there is a risk of fall, which is seen. If the patient lives alone and is not confident about the program, taking part in this program, or is not confident with using the technological devices, or he has a hearing or an eyesight impairment. So this is going to be your exclusion criteria. So it's very important when you are starting your tele rehabilitation, where you are deciding, you need to focus how, the inclusion exclusion criteria of your patients, which patients you can enroll into this program, which patients will be excluded, how you're going to monitor them. Are you going to, the prerequisites, are you going to send them the documents which they need to keep ready, the data which you need to acquire for them, all of this. So there is a lot of pre-planning which needs to be done before you're setting up the tele rehabilitation session for them. Then education. Now education plays a very important role in helping patients to acquire the knowledge and the skills to self-manage their chronic lung condition. You need to educate them. You need to ask them questions like, they are open-ended questions, give them affirmation, give them reflection, a summary. Then when you are educating them, you can also ask them what is their main problem, what do they want to focus on. So you build that rapport with the patient. And then one very important thing is, if you want, you can focus on the SMART goals, that is, which are specific, which are measurable, achievable, realistic, and time based. So you will be able to achieve what the patient, like, you will have data on which you will be able to help the patient. So when we are talking, after we have done all this, then comes your tele rehabilitation, where you will be doing, maybe you have done in the assessment, your all test and all. Then you have a program which is formulated. That program is used for a period of 8 to 12 weeks. And then your entire rehabilitation program, it's normally a 30 to 40 minutes program, which is taken place. Now, this is from a study which was done in a population in India, where how they had conducted their tele rehab, which is via smartphone. After you have done the entire rehabilitation program, if it's an 8-week or a 12-week program, again, the focus is on assessment, that is reassessment, to determine your effectiveness of your entire intervention. So the entire questionnaires which were used are going to be repeated. You're going to check your objective, subjective measures. You're going to review the goals and discuss regarding the ongoing management, and you're going to also tell them about the maintenance for exercise. So this is again a very important thing to know how well or how effective your program has been. So when we're talking about tele rehabilitation, our focus should be on teleassessment, because once you know the areas where you need to work on in the patient, it will be much more easier to formulate your rehabilitation program. So the focus is going to be on detailed history. It's going to be on educating the patient, on selecting the right patients which are fit to do a tele rehabilitation program, on monitoring, that is, which devices you're going to use for monitoring the patient, and which outcome measures are you going to use. This forms your basis of your teleassessment, and your teleassessment is the most and the first step for a successful tele rehabilitation program. Thank you.
Thank you so much for such a wonderful session on telerehabilitation. Personally, I had a lot of reservations for telerehabilitation because as a physiotherapist, we are always taught as a physiotherapist, we are always taught that palpation is very important skill and everything. So again, of course, there are many challenges when we are trying to tackle the patient using a virtual platform. But yes, of course, if all of us get trained properly, then how to use the technology, then of course our reach is going to be much more, and we'll be able to help a larger section of society who actually are candidates for pulmonary rehabilitation. Thank you so much. But then I would like you to add on a couple of points. So in your talk, you mentioned about the inclusion criteria, where you spoke about the technology access by the patient and what equipments a patient can have, whether or not they are techno literate or not, whether they have accessibility to this such kind of platforms where you can have this interaction via virtual medium or not. But looking at a medical condition of the patient, are there any strict no-nos for tele-rehabilitation in pulmonary rehabilitation?
Yeah. So now if you're looking at a medical condition, which you will see that if the patient is very breathless, if you have heard it from the caregiver that the patient is very breathless, or the patient is going to be on the bed where the patient is not going to be able to sit in front of you on a chair where you are conducting,
Right.
or maybe when you're giving exercises, there will be a designated area for that. If they are not able to conduct, then those patients we would not advise for tele-rehabilitation, because you also have to remember that during tele-rehabilitation, if there is an untoward incident, you are not present. So that's why when you're selecting your patient, it's very important for you. That's the reason you need to focus a lot on assessment. If you know their dyspnea level, when they are exercising, maybe a normal walk in the house from one room to the other, are they feeling dyspneic? So depending on that, you can take a call and decide whether you want to call the patient for a tele session, or you want the person to at least have one session with you in the presence and then maybe convert it into tele sessions. So if you will see now with the pandemic, where the numbers of the cases and all are going low and everything is gone back to normal, a lot of patients prefer that they come for one session where you do an assessment. You can do a proper 6-minute walk test, and you can come to know if there is, any desaturation which is taking place, and then you continue knowing, because you will be at a better way for them to conduct it in the house. So a lot of people do that model also.
Right. Right. And you mentioned about right now, you mentioned about that untoward incidences which might happen and we are not here. So even though maybe at the beginning our patient is pretty much stable, we had that first session, but accidents do happen, right? It's not in our hands. So are there any guidelines or protocols that if you are conducting a tele-rehabilitation session, and if you feel that the patient needs to be seen by somebody, it looks like some kind of medical emergency, or it looks like a red flag where I need to intervene personally, or a medical professional needs to see the patient. So is there any protocol which is in place, and where a patient also needs to be taught about that before enrolling the patient into the program?
Your patient education will focus on that, where you're going to be telling them that if they have any chest pain, or maybe if they are having, before your session, they have done some activity after which they're feeling a lot of dyspnea, that they inform the caregiver, or they inform directly to the therapist who is seeing them. That is an important thing. The next thing is, if you're going to educate them about their condition, for them also it will be better to manage and cope up, like you teach them coping strategies. That would be an important thing. And you also have to remember that if you feel at any point that there is a red flag, you discontinue the session. That's why have a caregiver around, so that you can immediately call them and tell them to rush to a nearby center, or whatever is the most appropriate thing to do at that time.
Right. So basically, when I'm giving a tele-rehabilitation, I should always keep it in the mind that I should not be very heroic or very aggressive about it. I should always have that factor of conservation and a protocol or emergency protocol in my mind, because how much ever a patient is taught about, even a caregiver is taught about it, but when the situation comes, they need to keep it calm, and even you need to keep it calm and then act on it. Of course,
That is,
shouldn't happen with thorough assessment, but sometimes
never know. With medical
we
conditions,
never
you
know.
never know.
One last question about the practicality and cost effectiveness of the telerehabilitation. Now you are into the telerehabilitation since quite some time. So how do you feel? Is it more cost effective or
So now that's a question which you have asked. It's a very good question, because if you're talking about cost effective, there are certain people who have a good medical insurance which covers rehabilitation. Till now, we don't have medical insurances, at least in India. A lot of companies are not giving medical insurances for a teleconsult program. So if people want to use their medical insurance, they prefer coming, where they can obviously have access because they have paid for the medical insurance, where they can go to the setup and maybe they will be reimbursed. But when we are talking about people who do not have, the charges are going to be better, like it's going to be cost effective for them because they're not traveling, they're not wasting time. Next, in travel, as well as there is going to be no caregiver which is there, so the caregiver's time is also saved because the caregiver is just present only during the session, which is for 30 to 40 minutes. So that is also, so there are two sides to the coin when you will say about the cost effectiveness of this program, because people who want to reimburse for them a tele rehab, all your insurance policies don't cover tele rehabilitation. Now maybe with a rise which is seen, there might be new policies which would be considering that, but till now there have not been.
so basically there is a lot of scope for policy making, even a
Right.
lot of scope for research, because that way it is not a very structured field. So I think there is a lot of scope for research starting from the tele-assessment, where we need to establish the validity, reliability of most of the outcome measure if they are done on face-to-face basis versus via tele-rehabilitation,
A lot of
as well as the this thing. I think that
this
is
will be a great, we will have lot. And till now, if you will see, none of your societies, whether you have an ATS or you have an ERS or a BPS, which is not spoken on the tele rehabilitation, though there are a lot of articles on tele rehabilitation, there is not a specific guideline by any of these big societies which are focusing on tele rehabilitation. Though there are singular studies which are talking that COPD patient, some RCTs are there, or maybe a lot of focus on long COVID is there with tele-rehabilitation, but not a specific structured guideline. How we have guidelines for pulmonary rehabilitation, which is center-based, we do not have that. So that is like something which we will, I'm sure, will be seeing in the future, a lot of research and publications on that.
Right, definitely, and that would open up a new avenue for the patients as well as for the therapists who are willing to access a patient who's not in a vicinity, where that will of course increase the patient outreach as well as a therapist's reach towards the patient. Thank you so much, Rashida, for such a wonderful session. It was pretty aptly formulated, and I know there are a lot of things which can be elaborated on. We have given you a very short time. We would like to hear from you in details, maybe in future sometime. I would also like to thank you, our Chairman of Sancheti Group, Dr. Parag Sancheti sir, our Executive Director, Mrs. Manisha Sangvi ma'am, and our technical team. Thank you so much for providing us technical support for this Physio TV session. Thank you so much.
Thank you so much for inviting me over here. It was a great pleasure to give this small talk on teleassessment and rehabilitation. Thank you so much, Dr. Prajakta.
Thank you so much, Rashida. Thanks.